Well, good evening and welcome to another edition of Question Lab. I'm your host, Jeff Downing, and tonight we are going to take you through a set of questions connected to neuropathology. So we're going to need your brains in full gear tonight. We've got some good questions for you, and hopefully we've got a lot to share. A lot of knowledge that we can hopefully dispense for everyone showing up here tonight. To help me is our main co-host here, Dr. Paris Vicaria. Paris, would you like to introduce yourself to the crowd tonight?
Sure, thank you, Jeff. Hey guys, my name is Paris. I am an assistant professor in dermatology, and I'm also an RX coach with USMLE-Rx. So I help host sessions and question labs such as these. I'm happy to help lead tonight's session on neuropathology.
What we're going to do is we're going to be walking you through a set of questions related to neuropathology. And we're going to do it following the methodology used by RX Coach and preferred by the team here at USMLE-Rx. And you're going to see the things that and the steps as we work through them with you. I think the key thing for us is that we really want to help you not only learn a little bit more about neuropathology or kind of assess how much you know at this point, but really help you learn how to answer these questions, how to both prepare for and perform well on board style exams. So you'll hear us kind of providing some tips along the way, and hopefully you're going to be able to take away some good pointers, both in terms of answering these questions and answering any type of question on test day. So let's go ahead. We're gonna start with question number one, and the first thing you're going to notice here is that the answer choices are not here, and that's because we suggest that you cover up those answer choices when you get started. And part of it is that we really don't want you to get freaked out if you see an answer choice that contains a term or a disorder or something that you're just unfamiliar with or you don't feel confident about. Sometimes, especially in test day, you've got it's a high stakes situation, lots of anxiety you're dealing with, right, and a lot of things that are kind of out of your control. So we feel like if you can stay as focused as possible throughout that and take these questions in a very specific way, that your chances of staying on track and staying focused and in the moment are much greater. So what we say is we cover up those answer choices and then we read the lead-in first. So we don't start with the vignette, we start with the lead-in. And partly this is so that you know what you should be thinking about and looking for as you read the vignette. Sometimes, and in some cases, you may have already experienced this where the lead-in provides you with all you need to know in terms of answering the question. That's atypical within most USMLE exams, but it is good to know exactly what it is that you're trying to solve before you get into the story. So what we're going to do is we'll start with that lead-in. Which of the following is the most likely cause of this patient's symptoms? Okay, so now you have a bit of an understanding of what you're looking for as we read the vignette. A 10-year-old boy is brought to the pediatrician with 1 month of headache, nausea, and vomiting. The headaches are dull, worse in the morning, and not effectively relieved by acetaminophen or ibuprofen. He does not report snoring. On examination, the physician notes impairment of upward gaze. Results of fundoscopic examination are shown. MRI of the brain after contrast reveals an abnormal mass with calcifications located at the third ventricle. So again, which of the following is the most likely cause of this patient's symptoms? Think about that. Head over to the question box. Let us know how many steps you think it will take to solve this question. You think it's a one-step question, a two-step, three-step? Let us know as I pass it over to Paris. Paris?
Thank you, Jeff. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? And so starting off, you can see that we're given demographics, 10-year-old boy. And generally with clinical questions, that's the first thing you're going to be given. And that's kind of the first thing that you do want to make note of. That'll automatically clue you in as to what kind of things you should be thinking about. In this case, we're told it's more of a pediatric case, a 10-year-old boy. And then they're telling us that he's coming in with headache, nausea, and vomiting. Those are what we call the presenting signs and symptoms. That's what brought him in to be seen by the doctor, come to the ER. In this case, they're also tell us how long it's going on for. So you want to make note of that. That can give you a clue as to if this is an acute issue, a chronic issue. And we know this is kind of, subacute, kind of early chronic, 1 month going on, okay? So anytime you're told about headaches and vomiting, you want to ask about the headaches. You want to see, what characteristics are there. In this case, we're told it's not relieved by medications. It's worse in the morning. It's dull. He has some vision changes. And then there's some specific MRI and fundoscopic exam findings they tell us there as well. So you definitely want to make note of that. So now they're asking us the most likely cause of the patient's symptoms. So I think we've got a couple steps here. I think one, we've got to figure out what's going on with this patient. What's the condition, diagnosis, and then two, what might be causing that, like at the etiology or pathogenesis of that condition. So maybe a two-step question here. So let's go ahead and let's take a look at those answer choices. And what you see here are 5 answer choices. And when we work with students, we actually recommend that students start at the bottom, or answer choice E, and work their way up to the top, answer choice A. And the reason we do this is because a lot of times we'll see students who start at the top, they'll select something they like without going through all the answer choices. So sometimes they'll get that question wrong as a result. So we recommend doing it this way to not make that mistake. So let's go ahead and let's do that now. Answer choice E, pituitary adenoma. D, pineal tumor. C, hypothalamic hamartoma. B, epidermoid cyst. And A, craniopharyngioma. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here. We'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So the poll is open. Go ahead and let us know what you think is the most likely cause of this patient's symptoms. We do, we do suggest, especially you're in a difficult topic like this, that you may have some questions that just confound you, right? Or you've got a question where it's like, gosh, I've got 2 really good answer choices here, or 2 answer choices that I can't really decide, between. Our main, suggestion is that you do need to answer every question, right? Don't leave a question unanswered on test day. It's not going to count against you, so it's worth taking a shot. Okay, so let's go ahead and close this poll and share the results. And let's see. So it looks like in this case, we've got a 2-horse race, right? About 40% of you went with craniopharyngioma, and 44% thought it was answer choice D, pineal tumor. So let's go ahead and hide those results and reveal the answer. And the answer to Question 1 tonight is answer choice D, pineal tumor. So well done, everybody. Good start to tonight's session. Almost half of you got that one right. But over half of you, didn't get it right. And that's okay. It's okay to get it wrong during question lab because Paris is here to help explain it. Paris?
Yes, thank you, Jeff. Yes, great job on this question, guys. Definitely challenging question. We don't, commonly see pineal tumors, but they are important to know about. So let's take a look at what's going on here, okay? When we take a look at this, there are some concerning signs that this patient has a tumor in the brain automatically, and that is a headache that's worse in the morning. So when you're laying down, there's more pressure in the head, and so you wake up with a headache in the morning. It's not relieved by medication. And then obviously we're told about the vision changes. We're told about the mass with calcifications in the third ventricle, okay? And then on fundoscopic findings, basically what they're kind of showing there is a swelling of the optic disc, meaning papilledema, indicative of increased intracranial pressure, okay? And specifically, those findings of the MRI are consistent with the pineal gland tumor. So if you take a look at the next slide, and we take a look at our childhood primary brain tumors, remember this is why it's important to realize this was a pediatric case, because childhood tumor incidence is different than adulthood brain tumor incidence. You can see that pineal gland tumors are more common in males. They present with obstructive hydrocephalus because they can compress that cerebral aqueduct. And then you can get Parinod syndrome, meaning you have upward gaze palsy, nystagmus as your primary findings there. And we do know that our patient, importantly, if we go back to our question and we take a look at that vignette, that our patient did have impairment of upward gaze. That's a very characteristic finding of Parinod syndrome, which is also seen in pineal tumors. So those are all things that kind of point specifically to pineal tumors, okay? Now the other answer choices, in case you selected that, pituitary adenoma, as well as craniopharyngioma, that would be more consistent with seeing bitemporal hemianopsia on visual field testing, not so much impairment of upward gaze. Hypothalamic hamartoma, that would be associated with some endocrine issues, hormonal imbalances. An epidermoid cyst is more within the skin and layers of the skin, not that deep within the brain, and wouldn't be causing that intracranial pressure. So the answer choice here, like you guys picked, is D. So great job on this first question.
Excellent, thank you, Paris. So again, we're off to a good start here. Let's see if we can keep it rolling as we go to question number 2. But before we do that, I want to point out that if you are looking for a good study planner, we've got a free one that is completely integrated with First Aid for Step 1. So our Rx study planner, which was designed by Art Janier, who you've probably seen through his Express videos or the RX Bricks podcast. He designed this for his students, and it's a great tool that will help you not only kind of put together your plan, but help you adapt your plan based on the areas in which you may need more help, right? So if neuropathology is a tough one for you, you can let the tool know, and it will adjust accordingly so that you spend more time on it. It's a great tool, a great way to get started, especially if you're thinking about taking step later in 2023, and you can use it for both step 1 and now for step 2, which we just released a few months ago. So I'll put this in the chat, and you can go ahead and get set up. Okay, let's go ahead and start question number 2. Again, we've got the answer choices covered up, and we'll start with the lead-in. Which of the following additional physical findings is most likely in this patient? So again, we've got another most likely type of scenario in here. So let's go ahead and read the vignette. A 25-year-old man comes to the emergency department because he has been dizzy and nauseated and unstable while walking since undergoing a chiropractic treatment for neck pain several hours ago. Physical examination reveals absent pinprick and temperature sensation on his right face, left trunk, and limbs, ataxia of his right extremities, left beating nystagmus, and hoarseness. Which of the following additional physical findings is most likely in this patient? Go ahead and hit that question box. Let us know how many steps you think this one is going to take in order to solve correctly as I pass it over to Paris.
Thank you, Jeff. Yeah, so let's take a look at this question now. So now we've got a 25-year-old male. Okay, so that's an important clue there. And he's coming in because he's dizzy and nauseated, okay, and unstable when walking, okay. And they tell us that this started just a few hours ago, specifically after a chiropractic treatment. So we have his presenting signs and symptoms there. We were told this is very acute, okay. And we're also told about a potential trigger, okay. So you want to make note of those. Those are all important clues. Then obviously with neurology and neuropathology, you definitely want to make sure you know how to localize things and know those important neurophysical exam findings. So you definitely want to take note of those there. So then they are asking us an additional physical finding most likely in this patient. So I think we've got 2 steps here as well. I think 1, we've got to figure out what's going on in this patient, what's the condition, the diagnosis, and then 2, what is an additional physical exam finding we would see in that patient. So I think we've got a 2-step question here. So let's take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, right-sided ptosis and meiosis. D, inability to recognize the left side of his body. C, hyperreflexia of the left extremities. B, diminished vibratory sensation in the right extremities. And A, deviation of the tongue to the right. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, excellent. So the poll is launched. Let us know which of these additional physical findings is most likely in that 25-year-old man. Looks like you guys are off to a good start with this one. Got a good crowd for you, or a good crowd out here tonight. We do have a raffle that'll take place at the end of tonight's session, and we also have our current special. We've actually extended our Cyber Monday special. So again, it's the best time to purchase an RX subscription. So we'll talk a little bit more about that later on. Let's see. So about 80% of you have voted. So let's go ahead and close that poll and share the results. Okay, so again, a clearer leader in this particular instance, with almost half of you voting for right-sided ptosis and meiosis. Deviation of the tongue to the right also got just a little over, about 1 out of 5 of you chose that one. So very interesting. Let's go ahead and hide the results and share the correct answer. And the correct answer is answer choice E, right-sided ptosis and meiosis. Great job, guys. You guys are off to a really nice start tonight. If you didn't get this one right, that's okay. We're going to walk through it right now. Paris?
Yes, thank you, Jeff. Yes, great job with this question, guys. It is a tough question. These stroke type questions are definitely tough. So let's make sure that we understand what's going on here. Okay. So if we take a look at this 25-year-old male, the key thing here is that he had that chiropractic manipulation, okay, or treatment, and that then caused neck pain several hours ago. Okay. So what likely happened is that he developed an acute stroke secondary to that manipulation. Okay. What ended up happening is we've now got to figure out, which area is he developing a stroke in, what artery might be affected. Okay. And so what we know is he's got absent pinprick and temperature sensation on the right face, and then also the contralateral trunk and limbs. He's got nystagmus and hoarseness. Okay. Now the hoarseness is specific, fairly specific, for lateral medullary syndrome, or what used to be called Wallenberg syndrome, where the PICA, posterior inferior cerebellar artery, or PICA, is affected. Okay. So if you take a look at the next slide, there's that big table on strokes in first aid. It's very important, very high yield. And this is the part on strokes of the PICA, PICA. Okay. Now you can see there that what's highlighted under symptoms is dysphagia or hoarseness. Okay. And the reason that's highlighted is because that is more fairly specific to this specific artery. Okay. You can get vomiting, vertigo, or nystagmus in a couple different types of stroke syndromes. You can get Horner syndrome, issues with pain and temperature sensation in a couple different stroke syndromes. But what's most important, what specifies it, is that dysphagia or hoarseness, like this patient had. Okay. Now, what you can see there also under symptoms is ipsilateral Horner syndrome. Okay. So patients with this stroke can also get Horner syndrome, where you get ptosis, meiosis, and anhidrosis. Okay. Because that's affecting the sympathetic fibers. So this patient might also, as a result, have ptosis and meiosis, which was the correct answer here. So if we go back to the answer choices, hopefully you can see why E is the best answer here. Okay. Now the other answer choices, in case you selected that, so D, inability to recognize the left side of the body. That would be if you had a lesion or stroke to the non-dominant parietal lobe, which is supplied by the middle cerebral artery, so a different vessel. Hyperreflexia of the left extremities, that would be more so with upper motor neuron damage, so a little bit different than what we're talking about here. Diminished vibratory sensation in the right extremities and deviation of tongue to the right, that would be seen in medial medullary syndrome, which is due to strokes of the anterior spinal artery or vertebral artery. So a little bit of a different stroke syndrome there as well. So great job on this question. Definitely a tough one, but great job on this question.
Yeah, definitely. This is, these are the ones that you need to be ready for on test day. So nice job, everybody. Let's go ahead and take a look at question number 3. And again, you'll see that all of the answer choices are covered up. And we'll start with that lead in. Which of the following agents is the most likely cause of this patient's neurologic findings? Think about what kind of information you're going to look to extract from the vignette as we read that. A 67-year-old man living with HIV comes to the emergency department because of headache, blurred vision, confusion, night sweats, and generalized weakness for the last 2 weeks. He says he has also lost 8 pounds during the last 2 weeks. Temperature is 38.8. Physical examination is unremarkable, with the exception of lymphadenopathy. Laboratory testing shows a CD4 cell count of 80 cells. MRI of the brain reveals a solitary lesion that is ring-enhancing and well-circumscribed. He is treated with sulfadiazine and pyrimethamine but worsens clinically. A repeat MRI 5 days later reveals that the lesion has grown in size. He dies 6 days after hospitalization. Brain autopsy reveals high-grade lesion with CD20 cells in an angiocentric pattern. So again, which of the following agents is the most likely cause of this patient's neurologic findings? Go ahead and let us know how many steps you think this one is going to take to solve as I pass it over to Paras.
Thank you, Jeff. So let's take a look at this question now, okay? And you can see here that this is a little bit of a longer vignette, okay? We can get those in step one. So it's going to be very important that you pick up on those important clues. And also that, the clues that you come in contact with earlier on, like in the first 1 or 2 sentences, that you don't forget about them. So it's important that you highlight them and make note of them, okay? So here we've got a 67-year-old male, okay, so an elderly gentleman, and they tell us right off the bat some of his medical history. So you know that that's going to be important. He's got HIV, okay? And he's got a few things: headache, blurry vision, confusion, night sweats, weakness. So a lot of presenting signs and symptoms. And it's been going on for 2 weeks, okay? From that point on, you can see there's a lot of additional important clues there. Weight loss is important. You always want to ask about weight loss in this kind of question and make note of it if you see it. He's got a fever. He's got lymphadenopathy. They tell us about this imaging finding. And then they tell us that he was treated with a couple things. We want to make note of what he was treated with, but that he worsened. And then we see some repeat imaging, and we kind of need to interpret a lot of that. Okay, so a lot of clues there. Okay, they're then asking about which agent is the most likely cause of this patient's the neurologic findings. So I think we've got a couple steps here. I think one, we've got to figure out what's going on in this question, this patient. What's the the condition, the diagnosis, and two, what is the causative agent? Okay. And I think that first step will be a little bit intensive because there's a lot of clues there that we'll have to piece together to come up with the diagnosis. But then once we do that, then we'll just have to figure out what the causative agent for that is. Okay. So a two-step question here. So let's go ahead and let's take a look at those answer choices. And once again, we're going to start at the bottom and work our way up to the top. E, Toxoplasma gondii. D, JC virus. C, Epstein-Barr virus. B, cytomegalovirus. And A, Cryptococcus neoformans. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, so this is one of those types of kind of a blockbuster question. You get hit with all kinds of information that you need to be able to quickly sift and sort. Your hope is that you can get through this in roughly 80 seconds, right? So here's a good test for you. And you can tell just by the amount of items that we've highlighted here that there's a lot that you need to keep an eye on. Okay, so we've gotten about almost 2/3 of you voted. I'll keep it open here a little bit longer. Always with these types of questions where there may be more than one that are valid responses. So you have to be able to prioritize here. So let's go ahead and close the poll. Good response so far, and we'll share the results. And it looks like about 40% of you went with Epstein-Barr virus, and about a quarter of you went with Toxoplasma gondii. So, but all the answer choices here received double-digit votes. So we'll be interesting to see what the answer is for this one. So we're going to hide those results and share the answer. And the answer is answer choice C, Epstein-Barr virus. So guys, we're 3 for 3 tonight. You guys are really crushing it tonight. Now, obviously, not everyone got this one right, but good job nonetheless. If you didn't get it right, that's okay. We are going to do you the favor of breaking it down for you. Pars?
Yes, thank you, Jeff. Yes, definitely a tough question here. So, but great job on this one as well. So let's take a look at what's going on here. Okay. So we've got a patient with a very lengthy history. Okay. And the primary thing that they're getting at is he was treated with sulfadiazine and pyrimethamine, but worsened clinically. Okay. And it seems like they might have thought that the patient had a different lesion or a different something else going on that we'll talk about, when actually he had something else going on. So essentially what you see there in that image is a solitary tumor, okay? And what this patient has is a primary CNS lymphoma, okay? Now these are rare tumors where you get a primary, so it means it's not coming from somewhere else, it's not metastatic, it's forming there, okay? And it's a lymphoma within the CNS system, so primary CNS lymphoma. It's rare, but it's more common in patients with HIV or AIDS, specifically CD4 count less than 100. We know his is 80, okay? And what you see is a ring-enhancing lesion with an angiocentric pattern of CD20 positive cells, just like they told us in that last statement. Now that is a little bit more of a factoid that maybe not everyone knew, but there are still other clues in there to help get to that diagnosis, okay? Now this is a type of non-Hodgkin's large B-cell lymphoma, okay? So if we take a look at the next slide, we can take a look at some of those common diseases of HIV positive adults, okay? And you see there in CD4 count less than 100, one of them is patients are at risk for EBV-driven B-cell lymphoma, or primary, such as a CNS lymphoma, okay? And this is ring enhancing, it may be solitary, okay? And what happens, you can see there specifically how they mentioned versus toxoplasma, okay? So if we go back to our question in our vignette, what they were getting at is patients are often initially treated with sulfadiazine and pyrimethamine because they're thought to have toxoplasmosis, because that's much more common. And they usually respond to that treatment, okay? In this case, the patient didn't, and he worsened. Okay, so it's actually probably not that, and instead primary CNS lymphoma driven by EBV, okay? Now the other answer choices, in case you selected that, so E, for example, that is getting at what he was maybe treated with, as we know that he didn't really respond to that, okay? And oftentimes you have multiple ring enhancing lesions, okay? Although they can present with solitary as well. JC virus, that leads to more progressive multifocal leukoencephalopathy, so more of a neurodegeneration, not so much solitary ring-enhancing lesions like that. Cytomegalovirus, answer choice B, that can cause encephalitis, so again, not presenting with a tumor. And lastly, answer choice A, that is an opportunistic fungus that can cause a meningitis type picture. So a little bit different again than what's going on here. So C and E are probably the two answer choices to be between, and hopefully now you understand why E is not as good and C is the best answer here. So great job on this question as well.
Yeah, excellent. Thanks, everybody. You guys are doing a great job. We've got one more question to go. I do want to point out that if you are unfamiliar with the RX Bricks podcast, it is a great way to study on the go. So whether you are heading to the gym, walking the dog, doing dishes, you can keep studying on the go. So we've been producing the Rx Bricks podcast for almost 2 years now. So we've got somewhere close to 150 episodes that cover a lot of the high yield topics that are within our Rx Bricks library. So if for some of you, school's going to be out here pretty soon. You've got exams coming up. It's a great way to stay sharp, especially over the holidays, and it's also a great way to remediate, especially if you've got some topics that have given you trouble. So we'll put the link there in the chat. Make sure you check out the Rx Bricks podcast. And with that, let's wrap it up. This is our final question of the night. Let's see if we can finish strong. So again, we'll start with the lead-in. Which of the following fundoscopic findings is most likely in this patient? So let's read the vignette. A 77-year-old man presents to the clinic with complaints of trouble reading, developing gradually over the past year. He has increasing difficulty seeing things in the center of his vision. He no longer drives amid family concerns about his vision impairment. He is otherwise healthy. He has a 50-pack-year history of smoking. Visual acuity is decreased bilaterally, and formal testing shows severe loss of central vision with intact peripheral vision. Which of the following fundoscopic findings is most likely in this patient? Think about that. Let us know how many steps you think it will take to solve this one as I turn it over to Paris.
Thank you, Jeff. Yep, so this is now our fourth question. And so hopefully you guys are starting to get a sense of what are those important clues in these neuropath questions to really make sure that you get that right answer, okay? So now you can see here we've got a 77-year-old male, so another elderly gentleman, okay? And he's coming in with trouble reading, specifically just trouble reading, okay? We do know it is more of a chronic development. Okay, developing gradually for the past year. Now, anytime, again, we're told about vision changes, you want to pick up on all those clues that they're telling you about what part of his vision, central vision, peripheral vision. We do know that he was a smoker, and then you can also see there important visual exam findings as well. Okay, so then they're asking us about fundoscopic findings most likely. So I think one, we've got to figure out what is his condition or diagnosis, and then two, what would we see on fundoscopic exam? So I think another two-step question. So let's go ahead and let's take a look at those answer choices. And once again, we're going to start at the bottom and work our way up to the top. E, flame hemorrhages. D, extracellular lipid deposits. C, cotton wool spots. B, cherry red spot. And A, arteriovenous nicking. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, everybody, we have launched the poll. This is final question of the night. We're going to have our raffle here in just a couple of minutes, so go ahead and let us know what you think. From this particular question. Again, just a reminder, we always want you to answer every question in QLab, but you definitely don't want to leave any questions unanswered on test day. Hoping that you found tonight's session to be helpful. Definitely let us know there in the question box what you learned tonight. Okay, we've gotten about 2/3 of you voted. I'll keep it open for just a few more seconds. This looks like this may have been a trickier question, just based on a little slower response time and kind of an even mix here in terms of the answers. So we're going to close this poll. and share the results. And you're going to see here that it's pretty even here. Most, almost a third of you went with cherry red spot, but you know, extracellular lipid deposits and arteriovenous nicking not far behind. And every answer choice again received double-digit percentage votes. So I'm going to hide those results and reveal the answer. And the answer is answer choice D, extracellular lipid deposits. So this one was the clearly the toughest question of the night. And with that, we're going to need to spend a little time with this one, Paris.
Yes, absolutely, Jeff. Yes, definitely a tougher question here. So let's take a look at this question, okay? So what we have going on is an elderly gentleman with progressively deteriorating central vision loss, okay, with normal peripheral vision. Remember, they told us intact peripheral vision. So this is suggesting macular degeneration, specifically age-related macular degeneration, okay? And of the two types, if we take a look at the next slide, we could take a look at the two types of age-related macular degeneration, okay? And you can see there with this that you get degeneration of the macula, which is the central area of the retina, which is why you lose your central vision, okay? But your peripheral vision can stay intact. Now, dry macular degeneration is most common, okay? And usually can see that with chronic comorbidities like we talked about previously in this patient. Wet macular degeneration is a little bit less common. That has to do a lot more with development of blood vessels that also can affect the eye and retina as well. So a little bit of a different issue there. And basically what they're getting at is the development of accumulation of drusen deposits, okay, in underneath the surface of the retina. And if we take a look at the previous slide, you could see there on that fundoscopic image we have those little yellow accumulations there. That's drusen, and drusen is lipid. Those are extracellular lipid deposits, okay? So drusen is lipid, okay? So the answer choice here is D. One of the things that highlights is, as we go through our medical training and we go through, a lot of our resources and learn things, a lot of times what we do is, we pick up terminology. Yes, drusen accumulates here, and we need to ask ourselves, do we know what drusen even is? And that is something that we can take to really any other organ system or basic science. So make sure that, if you're coming across a term that you're unfamiliar with, instead of just regurgitating that, make sure that you truly understand that term, that concept, so that you could essentially teach that to someone else. So a little bit of a good point here with this question. The other answer choices, in case you selected that, so flame hemorrhages as well as arteriovenous nicking, that you would see in hypertensive retinopathy, a little bit different than what's going on here. Cotton wool spots, more in diabetic retinopathy, and then Roth spots cherry red spot would be in a central retinal artery occlusion. So a little bit different here as well, okay? So great job on these neuropath questions tonight. Definitely makes up a big component of the pathology section in STEP exams. So great job, and I will pass it back to you, Jeff.
Well, excellent. Thank you, Paris. Again, great work, everybody. We had quite a few, tricky questions, but these are the types of questions that you're going to see on the USMLE Step 1, as well as the types of questions you're going to see in your NBMEs, in your CBSSEs. So there's a lot that you can gain from really digging into these. So well done. I do want to note that all of these questions can be looked up on USMLE-Rx. You can actually go to Rx search and just type in the QIDs. So by doing that, you can pull it all up and see more about the explanations, including some deeper rationales regarding why the incorrect options were incorrect. And we also have the related bricks and express videos and flashbacks that are connected to it, as well as the relevant pages from first aid for the USMLE Step 1. So lots of great resources in there, and make sure that you take advantage of it.